Today we're jumping into a really interesting option for managing labor pain. You might know it as laughing gas, maybe from a trip to the dentist.
Exactly. But it's used quite differently during labor.
Right. So we're going to unpack how it works in this context, how it helps you cope, really. Let's get into it.
Yeah, what's fascinating here is that nitrous oxide, it gives the birthing person a lot of control. It's self-administered.
Yeah.
Yeah, it's pretty unique. And it's gaining attention because it's so flexible and the effects are, immediate but also wear off fast.
Okay, so this laughing gas for labor. What exactly is it? Is it like the same stuff dentists use?
Well, yes and no. It is nitrous oxide, but for labor, it's always a specific mix.
Okay.
Exactly 50% nitrous oxide and 50% oxygen.
Wow.
You breathe it in through a mask. So same gas, but different concentration and very different setting than getting a filling, obviously.
Makes sense. And the big question, I imagine, for anyone listening, is it safe? For both mom and baby.
Absolutely. That's usually the first thing people ask. And yes, it's considered very safe. Critically, there are no known bad effects on the baby. And that's largely because of how your body gets rid of it.
How does that work?
It's actually the only labor pain relief method that's cleared just by breathing. It goes out through your lungs super quickly. So take the mask away, take a breath or two of regular air, and the effect is pretty much gone.
Wow, that fast.
Now, some people might feel a little bit dizzy, maybe slightly nauseous. But again, because it clears so fast, taking a few deep breaths of room air usually sorts that out right away.
Okay, so safety sounds good. But what about the experience? What does it actually feel like during a contraction?
Yeah, experiences do vary, person to person. But most women say it just helps take the edge off. It doesn't typically make the pain disappear entirely like an epidural might aim to. It's more about making the contractions feel less intense, more manageable.
So it helps you cope better.
Exactly. Cope better, feel maybe a bit detached, less overwhelmed by it all. And another big benefit is that it can really lower anxiety.
Oh, that's huge. Anxiety can make pain feel worse, right?
Definitely. So reducing anxiety is a key part of how it helps manage the overall experience.
And you mentioned flexibility earlier. What does that mean practically?
Well, a couple things. First, it allows for mobility. You're not necessarily stuck in bed. As long as you feel steady on your feet and with some assistance, you can often still move around your room.
That's different from some other options.
It is. Also, no extra fetal monitoring is needed just because you're using nitrous. And this is really important. It's not an either situation with an epidural.
Yeah.
You can use nitrous oxide at pretty much any stage of labor, early on, later on. And if you decide later you do want an epidural, you can still get one.
Okay, that flexibility sounds incredibly valuable, giving people choices along the way.
Precisely.
Now, you also said it's self-administered. This is where it gets really interesting, I think. How does that work?
It really puts the control in your hands. You hold the mask to your own face. Nobody does it for you.
Yeah.
You breathe in when you feel you need it. The key, though, is the timing.
Timing.
Yeah, for it to be most effective, you need to start inhaling about 30 seconds before you expect the peak of the contraction to hit. That way, the gas effect is strongest right when the contraction is at its strongest. It takes a little practice maybe, but you learn your body's rhythm.
That sense of control must be psychologically powerful too, especially during something as intense as labor.
It absolutely can be. But it's also important to know it's not for absolutely everyone. There are a few situations where you can't use it.
Like what?
Okay, so if someone physically can't hold their own mask, that's one. Or if they have a known severe vitamin B12 deficiency. And also if you've had certain types of strong pain medication like narcotics within the last 2 hours or so. Those are the main contraindications.
Got it. So safety checks are still crucial.
Always.
So if someone listening is thinking, this sounds like something I might want to consider, what should they do?
Good question. First step, definitely talk to your obstetric provider, your doctor or midwife. Discuss your health history. Make sure it's a suitable option for you personally. Then, if you decide you want it available, you can add it to your birth plan or birth preferences. And then just let your nurse know when you arrive at the hospital, assuming your hospital offers it, like Women and Infants does, that you're interested in using it.
Simple enough.
So really, if we boil it down, nitrous offers this unique mix of flexibility, that self-control aspect we talked about, and the fact it's so quickly reversible. It just gives birthing individuals another tool, another way to shape their experience based on what feels right for them.
It really broadens the picture beyond just, say, epidural or nothing, doesn't it?
It does. It fills a really useful gap for many people.